Are you a healthcare professional looking for a trusted concussion resource? Then you've come to the right place. From her New York City studios, welcome to Concussion Corner with your host, Dr. Jessica Schwartz.
Hello and welcome to Season 5 of Concussion Corner. My name is Dr. Jessica Schwartz, and I'm thrilled to bring back the Concussion Corner podcast after over a year hiatus. What we've done is we've actually built an academy called Concussion Corner Academy, and we've had over 100 graduates come through our walls in the last year as a new beta programming. The beauty of it is we are CE'd in all 50 states for physical therapy, occupational therapy, and athletic training, and we'll soon have speech, nursing, and we're applying for the Canadian Athletic Therapy Association as well for certification up north. We've had students in over 4 countries. We are so grateful to have started this project that's really derived from the Concussion Corner podcast. So we know that you guys have been listening to us in over 60 countries. You've continued to listen to us, hundreds of you per month over the last year and a half, despite us being dormant. And we're so excited to bring this back, specifically for the American Physical Therapy Association Combined Sections meeting in 2023, which is in San Diego, February 23rd to February 25th. So with that being said, we are bringing back a Concussion Corner short. Some new things that are going on this season. We are trying to bring back video or bring video to Concussion Corner. So we're going to be doing some video like this. We're going to try to use our YouTube more. If you are on YouTube, please follow us to help us grow. Please subscribe on your local podcast listening software as well. It really helps us out and helps us grow tremendously. Topics that we're going to cover this year are going to be the International Consensus Guidelines, which are going to be published in the late spring, early summer. We're going to highlight some early TBI researchers as well to kind of give them a boost in their early career. We're going to be covering NCAA Care Consortium updates, new topics like intimate partner violence, social inequities in concussion, which is also a new topic for us, and highlighting some nonprofits and so much more. With that being said, we are going to bring to you today a Concussion Corner short. That's part 1 of 2 with Dr. Becky Bliss. And Dr. Bliss is a clinical assistant teaching professor in the Doctorate of Physical Therapy program at the University of Missouri and is a board certified neurological physical therapist. She holds her certificate in vestibular rehabilitation from the American Physical Therapy Association, as well as Advanced Vestibular Certification, and is an impact trained physical therapist. Dr. Bliss's research interests include dysfunction of the vestibular ocular reflex following MTBI or concussion, as well as early detection of impairments that lead to post-concussive syndrome, also known as persistent post-concussive symptoms, and currently has several active studies specific to higher level motor cortical control deficit identification in the sport athlete. Dr. Bliss is active within the Academy of Neurological Physical Therapy and is currently involved in the knowledge translation project related to evidence-based practice at Missouri University Health. Additionally, Dr. Bliss is a faculty member here at the Concussion Corner Academy, and we could not be more thrilled to have her on board and back on the podcast to kick off Season 5 of our APTA-CSM Combined Section Opener. Again, thank you so much for coming back and to listening to us. Please tell your friends, tell your colleagues. We our Concussion Corner Academy and Concussion Corner podcast motto is teach one, serve many, and we could not be more excited to come back in 2023 and bring back all of the concussion conversations across interdisciplinary healthcare professionals. And just a reminder that this podcast here is designed for healthcare professionals, physician to physio to athletic trainer, occupational therapist, everyone in between, all of our rehabilitation brothers and sisters. We really want to make sure that we're highlighting the interdisciplinary nature of concussion and that it is a rehabilitative injury. So with that being said, we can't wait to be back in 2023. We can't wait for you to just tell a friend or 20 friends about us and colleagues. And please enjoy this podcast with Dr. Bliss. Take care. Welcome back, Dr. Bliss. I'm so happy to have you back on Concussion Corner. We're launching with the American Physical Therapy Combined Sections meeting that you'll be presenting at. We're so happy to have you back.
Thanks so much for having me. It's exciting.
Yeah, so our last podcast was officially in 2021. We built something called Concussion Corner Academy while we were in hiatus from the podcast, and that was a full-time gig. But we are so lucky to have 105 soon-to-be graduates, and we're so lucky to also have you on faculty. So thank you so much for believing in this little movement that we're trying to do.
Yeah, it's absolutely great. And I know it's intentional to have some time with the speakers, but I think my favorite part of the Concussion Corner Academy is being able to interact with the learners and have those like offline discussions that take a deeper dive into the concept. So it's been wonderful.
Yeah, and it's so interesting because what we've learned is actually that both the faculty actually learn from our students, because we're actually kind of taking the pulse of this international pulse of what's kind of needed in the communities. So it's been so great to actually see you guys think on your feet as well. I've learned so much from that capacity.
Yeah, absolutely. And it's nice to know the trends, right? Because we've got all this information coming out with research. And we know that, without any facilitation, it takes 17 years to fully get down into clinical practice. But it's nice to have, like you said, a pulse on the learners because they're spread out all over the world to know kind of where that knowledge has trickled down and maybe where we need to, expand our efforts in that implementation science field.
Indeed, and it's so great to have you so connected to both being a both clinician and a scientist. And I think really our students appreciate that 360, and they felt that all around. So it's really just been lovely to kind of see you think and see you interact and engage, and our students are loving it. So we're so grateful for you. And again, our motto at Concussion Corner Academy, which is now translating to the podcast, welcome back, is teach one, serve many. And I'm so happy that you're actually going to be presenting at the American Physical Therapy Combined Section meeting, and it looks like there's going to be over 15,000 participants. We're getting back into this kind of easing into this, I don't want to call it post-pandemic, but this endemic times. And I'm so grateful that you're going to be actually presenting for the American Academy of Sports Physical Therapy, the sports-related concussion, integrating optimal interventions across the, what is it? The whole thing, actually.
Oh, hold on. I've got it on my phone too. It is. It's okay. So it is sport-related concussion, integrating optimal interventions across the rehabilitation spectrum.
Rehabilitation spectrum. That was my chicken scratch as a physical
It's
therapist. So yes, it is. So kind of let's talk about that. Let's talk a little bit about what APTA-CSM is to you. I know that I haven't been since 2019. I miss it so much. I miss our people. I miss interacting and engaging. And then also the fact that you're doing a pre-con is so exciting as well. So let's hear about what APTA-CSM is for you and a little bit about your presentation.
Yeah, no, APTA-CSM, I love it. I feel like I get to see all of the people that I haven't caught up with in person. And you walk around and you're, saying hi and then lots of things. I went in 2020, so pre-pandemic was the last time I've actually been 2022. I was there last year in San Antonio. So 2020, 2021 was virtual. 2022 was that iffy, right? Not a lot of people attended. It was in San Antonio. There was a massive snowstorm, but people were still very like, you would do like the little wave and it was like, hey, but everyone was really I don't know if we should hug. I don't know how we should interact, those types of, you know what I mean? Just those awkward social reintegrations. And then this year it's in San Diego. So I'm excited. It's going to be mild, although I did just look at the weather and it's supposed to rain every day, which in some ways it's like, okay, then I don't feel so bad sitting inside, in the conference the entire time without enjoying the sunshine. So no, CSM is great. I love hearing some of the most up-to-date kind of research being translated through the sessions. The poster sessions are wonderful. The platform sessions are wonderful. And obviously the vendor, huge hall is always the exhibit hall. Just to kind of see what's coming down the pipeline as far as technology goes, especially in concussion management. You've got low tech and high tech. So I always get to go, get immersed into the Vertex CDP and all the virtual reality options that are out there. But then you've also got low tech kind of like Sway, which is the app based on your phone that you can do. And you can see kind of the new platforms, talk to the actual vendors, talk to the creators. So if I know last year, one of the big things from CSM for me was talking to Vertex and seeing and trialing their new VBT, which is the Vertex Vision Trainer. And then through conversations and say like, hey, what do you think about this? And this could be really, and then we actually we're one of the feasibility test sites for it here at the University of Missouri. So we've actually got it in our clinic, and that sparked from a conversation at CSM. So that's what I love about CSM is you're connecting and you're forming and bonding relationships that I don't think you would if you were sitting in your four walls of your clinic or your office.
Yeah, and I agree. And it's so amazing if you even just look at like some of the FOAM-Ed movement, free open access medical education, even the formation of the SAC back in the day with Mike McRae, all of these things kind of happened on napkin sketches at like either poolside or like at having a beer or an adult beverage or a coffee at a conference. And again, getting people together socially and interacting and mingling and kind of just taking the stress off of being in four walls of an office, I think just sparks so much creativity. And it's so wonderful to see people just at all like higher levels on presidents and things like that. And then we have these novice and we have students coming through as well. So it's just so great to see people just mingling and getting back together. It'll be 15,000 participants, 18 specialty sections and academies, 300 plus sessions, and 1,200 posters. So again, if you need a place to kind of get reinvigorated and in some sunshine with a little bit of rain, hopefully in San Diego, it looks like APTA-CSM is the place to be. So I'm so excited I'm so excited for people to go. We won't be going this year, but we're going to be supporting with a podcast. So we're so excited to participate. Okay, so in terms of your pre-con, the sports-related concussion integrating optimal interventions across the rehabilitation spectrum, you're going to be presenting with Jason Hugentobler and Bobby Jean Lee and Chelsea Ortega. Is that correct?
Yep, and Kevin Ortega. So I get both the Ortegas. So Chelsea, as far as the, sports physical therapist, and then Kevin as far as the athletic training piece. So we're, kind of infusing all of the specialties, which is really nice for the like collaborative practice model. And I just feel so blessed. I hate the siloing, right? Like, you're a sports therapist and you're ortho and you're neuro, but I do feel very blessed to kind of have an honorary membership within that group. As a neurotherapist with sport mindedness, I guess is what it's been called previously, of really thinking about the higher level neuromotor control, dual tasking constructs, and what does the athlete need to be able to do prior to return to play, especially putting all the principles of neuroplasticity there, and making sure that all pathways are firing at the levels and at the speeds that it needs to before the return to play. And hopefully we don't have the confirmed theories of why subsequent lower extremity musculoskeletal injury actually happens, but we have postulated theories. And so based on that, we can design rehab models that make sure that all those principles of neuroplasticity and practice are happening. And then also assessing constructs like dual tasking and reaction time.
Yeah, and we'll link all of those things in the show notes from your past podcast with us. This is a Concussion Corner short. And then we have some interviews also with Rob Lionel and some other folks with dual tasking. We're hoping to get, David Howell on as well, dual tasking, 101. So in terms of, connecting the bridges of an orthopedic injury and a neurological injury, and sometimes a cognitive injury as well with concussion, how do you see yourself fitting in really beautifully with the Sports Academy as a semi-styled, even though you kind of do all the things, a board certified neurological clinical specialist, kind of fitting in with the Sports Academy and the sports section? How does that meld with an injury like concussion so well?
Yeah, absolutely. And I think we could even bring more to the table if we think about kind of the heterogeneity of the injury itself. And if, we use the University of Pittsburgh Medical Center, so UPMC's clinical trajectory model, we can think about anxiety, mood, cognitive fatigue. So then we think about multidisciplinary collaboration, vestibular, ocular, cervical, and post-traumatic headache. And so if you think about that, that kind of branches everybody on the team, which is wonderful. And that's what, we've got here is that multidisciplinary approach, so that we've got all of the players at the table for intervention, but it's also fully communicating with athletic trainers the entire time. So, a lot of the times we're seeing our PT, AT, right, dual credentialed like specialists that are out there on the sidelines. And so when that happens, and I'm in my outpatient neuro clinic, right, my neuro, where we don't have, orthopedic specialists, we don't have sports specialists, we're all neurological, it's picking up the phone and having an appreciation of everybody's roles and responsibilities. So when I get a referral, typically from my on the sidelines or my sports medicine physicians, I'm picking up the phone whenever there is an athletic trainer involved and calling and saying, hey, it's Becky. I just saw so-and-so athlete. I need your expertise because you know them so well. You're interacting with them every day. You kind of see how either are they goofy, are they coordinated, are they not, are they elite? Is there social stuff going on? Is there like a parent factor? And I want to learn from them. And I really think that's kind of the bridge. I'm not on the sidelines. I don't have that ability. I also am not as well versed into some of the return to sport testing, although I'm starting to learn, which is great. So we all can learn and collaborate from each other, which is, what I think the best thing for the individualized approach for all the clients who have had a concussion or sustained an injury. So my neuro, I do have a specialized background in vestibular and ocular dysfunction. So I think that's where I come in, but you don't need to be a neuroclinical specialist to have that. You just need to dive deep, right? But I do think that helps. And then the fact that the neuroplasticity principles, motor learning principles, like thinking across the associative, like cognitive, associative, and autonomous, like stages of motor learning. And some of that is deep rooted into the neurological side of things, although it's really bridging, as we've talked about before in the academy, it's bridging more into that sports ortho world, especially with Dusty Grimm's, all of his work out of Ohio University. And so I would like to see the silos gone away. I would like us to all come to the table, like set egos aside and really have this like big think tank interaction for each one of our individualized patients as they come through the table. So.
Yeah. And I think, at the academy, why I built the academy, I feel like kind of like a mad scientist sometimes, just kind of like with these ideas, and then we put them to fruition. And sometimes we know what we're doing and sometimes we don't. And I've just had to let go of perfection, which is a healthy thing to do anyway, and just kind of do and implement, see one, do one, teach one. And, essentially that's what we're all about here for the podcast. That's in 60 countries. We're still getting over 300 downloads, and I haven't posted anything a week in internationally on the podcast, and we haven't posted since like fall 2021. But so, I take that seriously, that people are listening to us and our voices and our interdisciplinary voices. And essentially here, what we're all about is here's what I can do as a physio. Here's what you can do as a physician, a PA, an NP, an athletic trainer, an OT, a speech pathologist, and so on. And here's how we can treat together. And it has to be a we. This is not my patient or your patient. It's our patient. And it's so refreshing to kind of hear people like yourself who are really writing some of the clinical prediction guidelines for concussion, really, being a true clinician scientist, and also really on the ground teaching as well. It's really so rewarding. So, as we finish this up, Becky, thinking about your presentation, what are some of the highlights that you're going to, top 3 highlights that you're going to be teaching at the pre-con to kind of give people an amuse-bouche if they still want to come see you?
Yeah, absolutely. Introducing the requirements from the vestibular ocular system in sport. I think that's a deep dive that some people don't consider, because when we think about vestibular rehab, it's VOR times ones, and like it's so much more than that, right? For gaze stability and what's required within the like on the field activities that someone has to return to do. We're going to do arts and crafts labs, which we're so excited for, and make it more active learning. So the non-traditional passive learning. And so we've got a case that we're threading through the entire course, that like we're building upon it and letting the learners kind of think about how they would approach the case, and then kind of looking at that case-based clinical reasoning, and then hear from the expert, which is really great to compare and contrast and have that like self-assessment and self-reflective ability. And then I get to present all things dual tasking and principles of neuroplasticity. So I've actually got, based on all of the trajectories, videos. I always say it's movie time. Sit back, dim the lights, let's look at this. And it's like speed dating of all the amazing ideas that you can do for intervention, of incorporating all of these systems like cognitive motor, visual motor, vision, cognitive, and how do you put those pieces together? So I don't know. I love movie time and I love to talk. So it's fun for me.
Awesome. Yeah. And again, thank you so much for coming on. We'll talk a little bit in part 2 of Concussion Corner Shorts with you after this about some educational modeling and delivering of info during pandemic times and kind of how you've adapted and what you've learned as an educator and a concussion clinical scientist. But again, thank you so much for coming on. If folks want to find you either at conference or on Twitter is probably the best way to kind of track you down during conference. What's the best way for folks to find you?
Twitter is absolutely fine. It's at B Bliss DPT. I haven't changed my Twitter handle because it's too complicated. So look me up on Twitter and DM me waves. Come say hello. I love meeting people face to face. And then of course, just if you want to find me via email, you can do that at rebecca.bliss@health.missouri.edu.
Awesome. It is such a pleasure to have you on, and we can't wait for you to kind of educate, in our model of teach one, serve many, and you're going to serve so many at APTACSM, and we're so lucky to have you back on Concussion Corner podcast. So have a great day.
Thanks, Jess.
And now a word from our sponsor. Did you know that sport helmets are rated on a 5-star system similar to cars? And the safest helmets have nothing to do with price, brand, or availability? Since 2011, Virginia Tech researchers have been providing unbiased helmet ratings that allow consumers to make informed decisions when purchasing helmets. The helmet ratings are the culmination of over a decade of research identifying which helmets best reduce concussion risk. This work is done as part of Virginia Tech's service mission and is 100% independent of any funding or influence from helmet manufacturers. Our mission at Concussion Corner is to expose you, the listener, to trusted spaces in the concussion arena that translate to clinic next day. Please visit the Virginia Tech Helmet Lab website in our show notes or at bit.ly/Virginia Tech Helmets and spread the word to aid in lowering concussion risk in your community.
Thank you for listening to the Concussion Corner, hosted by Dr. Jessica Schwartz. The information in this podcast is for entertainment purposes only and not to be used as personal medical advice. Don't forget to follow us on social media on Facebook, Instagram, Twitter, and YouTube at Concussion Corner.